In 2017, I flew to Texas Medical Center and had emergency open heart surgery. The surgery was successful, but 9 weeks into the recovery, I had a stroke, which was very scary and made me more aware of life and how short it is. I was watching a YouTube video by Jim Batterman where he described these 5-HT2 drugs as quote unquote miracle grow for the brain. So naturally, I got very, very interested in it. I wanted to try it. I wanted to microdose to understand it, and I made that a part of my healing journey. I'm happy to say that I'm basically almost back to 100% today. So you have to think about it in the time horizons for what do the next 20 years look like, but what do the next 100 years look like?
Hi, everyone. Welcome to another episode of the Psychedelic Conversations podcast. I have with me Jeremy Caudill today. He is the founder of the Ninnion Psychedelics. And I'm thrilled to go into his story as well, because he has a very unique story how he came into the psychedelic space. Welcome, Jeremy. So amazing to have you.
Thank you, Susan. Very nice to be here.
So you are based in Austin, Texas, in the US.
That's correct.
Mm-hmm. Founder of the Ninnion Psychedelics, which we will go into that a little bit more in detail, but I just wanted to talk about the Ninnion Psychedelics for our listeners to give a background. So Ninnion is a pharmaceutical company on a mission to build a fully integrated pharmaceutical psychedelics ecosystem, leveraging the latest AI drug discovery, development, CGMP manufacturing, commercialization, patient clinics, and specialty pharmacy distribution network designed for the next frontier of the psychedelic medicine. Focused on the prior reimbursed market, Ninnion has begun developing a pipeline of next-generation psychedelic therapies with a clinical focus on brain injury, chronic pain, inflammation, and addiction disorders. Jeremy, that's really impressive. And as traditionally we begin our conversation with your background, if that's okay, if you could tell us a little bit about yourself and how did you come into this space?
Thank you, Susan. Yeah, so I was a pharmaceutical professional for about 20 years, had worked for a different variety of companies focused mostly on manufacturing and development of new drugs in the cancer and inflammation space. I've worked on 3 continents, sat on the executive leadership team for 3 different major corporations. And the last one was Samsung Biologics in South Korea, an expat assignment that I had. And it was during that time there that Samsung had just released their new Samsung Medical Center, where it had all these innovations and the latest equipment for imaging. And we get a fairly thorough physical exam every year as employees and executives of the company. And they picked up on an echocardiogram that I had an aneurysm of my ascending aorta and a bicuspid valve. And the aneurysm was large enough to be concerned about. And in 2017, I flew to Texas Medical Center and had emergency open heart surgery to repair the aneurysm and the valve. The surgery was successful, but 9 weeks into the recovery, I had a stroke. Which was very scary and made me more aware of life and how short it is after going through the surgery. And I went through the normal rehabilitation programs like the occupational speech and physical therapies. I recovered over the course of about 2-3 months, something like that. Thinking that I was in the clear 6 months after that first stroke, like most people, I had a second stroke. This time it was a double stroke on both hemispheres of the brain. Lost my ability to speak, face went down, arms, all the motor skill losses and all those kind of things that went along with it. And I really thought I was done at that point. I thought I would never, be able to function again. So my doctor advised me to put my businesses on the side to relax and recover. And so I got interested in three different things. One was learning how to fly fish, which I found very relaxing. One was learning how to make Texas barbecue, as I'm not really native from here. So it was a great, exciting thing. But the third and most compelling that brought me to psychedelics was around doing Google searches on how to heal the brain. So neurogenesis, synaptogenesis, neuroplasticity. And of course, when you search those things on Google these days, psychedelics come to the top of the rankings. I saw, legitimate studies from Johns Hopkins, from MAPS, from USONA, and the others. I think I was watching a YouTube video by Jim Batterman where he described these 5-HT2 drugs as quote unquote miracle grow for the brain. So naturally, I got very, very interested in it. I wanted to try it. I wanted to microdose to understand it. And I made that a part of my healing journey alongside the occupational, physical, and speech therapies. I'm happy to say that I'm basically almost back to 100% today. It's always a healing journey for us that on the long term, but I'm one of the lucky ones who survived. And I want to take the promise of these drugs to people who are in a very high, an area of very high unmet need, where patients, often in the age group of 18 to 45, they lose their livelihood. I think the statistics are something like $17.5 billion a year in lost wages. Not to mention the long-term care doctor's visits and follow-up, and which goes into the many billions of dollars every year. So in November 2020, I founded the company and started putting together the plan, pulling together the team. The first person I called up was Dr. Rick Strassman, who I did not know, but he liked my story and enthusiastically joined the company as my first scientific advisory board member. And from there, it's sort of expanded out. And now we have a really world-class team of experts from drug development to academic to industry, what have you, who are sitting us well poised to get to be successful in this space. So we have our first molecule, which is it's a substituted tryptamine, a psilocybin-like molecule with a short-acting, short duration time frame on it, profile. So we filed patents on that in the first quarter, and we are preparing for preclinical studies and hopefully be in human studies early next year, over phase 1.
Wow, that's wonderful. Thank you so much for sharing. And also thank you so much for sharing your story. It's very touching. I think a lot of people are touched by the stroke. It's really big in many families. It's one of those things that I think it requires fast action and really, the sooner we, get into that and taking action, I think there is a better chance in healing or recovering, at least. I like to just focus on the health side of your personal story just for a minute.
Sure.
This is really profound. I mean, having psychedelics as your ally in recovery is really super. It's for me is really profound. And just wanted to ask you, what type of psychedelic substances did you use? Is there a specific one that you work with, or what was the setting? What was the approach? I know you talked about microdosing. What was the protocol? If you could maybe just tell us a bit more.
So the substance was psilocybin, and that's what I used throughout my recovery. One of the things that struck me, and this will go back into how I utilized it, was when I was reading the Johns Hopkins studies. I've read about the end of life cancer studies that they were doing and the profound effects that it had on people. And the first thing that struck me was that, how different would cancer outcomes be, or how different would recovery outcomes be if somebody had a psychedelic journey immediately after they had this, right? Now, we can talk about the science of all the neuroplastic effects and all those kind of things and retraining the brain. But generally, I'm a firm believer that your attitude towards your recovery has a strong determination on the outcome. So imagine if instead of dosing people with psilocybin who had stage 4 cancer, you gave them that, the first month after they were diagnosed with cancer, right? How would the outcomes be different? Obviously we'd still do chemotherapy and the other things that go along with it, but would your attitude improve? Would your compliance with the protocols improve? Would your depression and anxiety be alleviated to this very difficult time during your life? And I just became very, very excited about that, because the parallel to stroke is a, it's a life-changing event for a majority of people. And if they do get back to normal, they're never really quite the same as they were before, right? And we're the lucky ones. So I became very excited about it, very passionate about it, and that's how I got to here.
That's amazing. Would you say, based on your learnings, based on your own experience, would you say if somebody, say, had stroke, say, years ago, a decade ago, and they are bedbound and they lost all their, motor skills, do you think there's still a chance for them if they were to opt into the psychedelic therapy, even though years gone by?
So that's an interesting question, and one that we're looking at now. When you have a stroke, the brain enters this hyperplastic period, right, for a period of time afterwards. And for those who don't know what the plasticity means, it basically means that when part of your brain dies, the function that went along with it also dies until you retrain another part of the brain, right? So you get dendritic cell growth, you get new synapses, you go into this hyperplastic sort of state, and that is able to be, it gets you in the mode to be able to relearn and retrain with occupational, physical, and speech therapies. The unfortunate thing is that the studies show that it's typically within the first 2 to 4 weeks after the stroke when you're most plastic. It took me, for example, almost a month to even get into a rehabilitation program, just based on the healthcare system here in the US. So what we're focused on in the beginning are the people who are in that hyperplastic state, right? We want to take them from the emergency room into the ICU into the rehabilitation care and really make that impact on it, right? Now, there are some studies out there that are showing how you get the brain back into that plastic state, right? One way is inducing another stroke. That's not really, a viable option. No one wants to have another stroke. So we are very interested in long-term sort of how do you reboot the plasticity and put these people back through it. I believe that, it probably will work. And the reason I say that is that in my own experience, I was probably months and months into my rehabilitation before I started using the psychedelics in the microdosing, and then eventually macrodose.
Wow, that's wonderful. Yes, that there is a hope. My understanding is also that if somebody's suffered so long in that state, I think they have nothing to lose but to try. There's always a hope. And okay, so that's good news. And so how do you feel about the current situation in the psychedelic renaissance? Because I'm pretty much involved in lots of conversations where there is a little bit of a pushback when it comes to isolating and creating your own, drugs and, working with specific, health condition or mental health. Or what are your thoughts? Why is it important now for you to, or for your team at least, to create something along these lines? Like I'm sure you're aware of the pushback, because for me, psychedelic renaissance is a movement of people from all walks of life. So we have underground therapists, we have underground facilitators, we have then the neuroscientists are now coming in, we have biotech companies and organizations like yourself, and we have so much is happening in this space right now. I'm sure you are aware of the pushback. What are your thoughts on that, and why is it important that we keep going anyway?
This is a really interesting question because, I think there's a lot of tendency within the market to sort of parallel the cannabis industry with the psychedelics industry. And I think they have a couple things in common, but it's where they stop. So the both of them used to be illegal, right? Not some of them still are illegal, right? But they're moving towards decriminalization. They're moving towards legalization. And so when I looked at the market, I said, well, what nature creates is already perfect, right? I mean, psilocybin is a great drug. It's very gentle. It works for people. But then I saw the way that it was being implemented in sort of a biotech FDA type of setting, right? And so you've got psilocybin, which I knew, and MDMA as well, which there are variabilities in onset, right? It can take up to an hour and a half. Practically, what does that look like in a doctor's office, right? How do you stage that and make that work, right? Then they're high touch. So you've got two therapists who are sitting with one patient for an 8 to 10 hour session, depends on how the patient works, right? So I thought, well, how is this going to be reimbursable from insurance, right? How are they going to make the case for how this works? And logistically, how are you going to set up these clinics to work? So I saw the legalization movements happening, and I thought, well, these patients, if you legalized all of these drugs tomorrow, like we did for CBD, for example, there's half the population who would say, yeah, let me try that. That sounds great, right? There's the other half of the population who's not going to touch it unless it's been through the FDA, blessed by their priests, and done, in a pharmaceutical way with a certain purity. And that's where I saw that I could bring my network to fit into adding value to this. So these people, as we normalize, not just through the laws and the decriminalization, but we normalize it as a pharmaceutical medicine, then I think we're going to expand access. It's not just going to be a therapy where you're going to have to be rich and pay $5,000 for a weekend session in a nice clinic. It's going to be a $20 to $50 copay, right? And that's the way I think we gain the biggest expansion of access for these drugs is through that method. Now, that said, once you've tried psychedelics, once you've had them, I imagine most of those people are probably not going to be afraid of a mushroom. They're probably not going to be afraid of these other things, right? So you have to think about it in the time horizons for, what do the next 20 years look like, but what do the next 100 years look like? And I think we're focused on the next 20 years and getting the other half of the population access to these drugs.
Yeah, that's great. Thanks for your insights. So, as I said earlier, I am looking at some of the organizations who are really passionate about the indigenous way of working, very passionate about the reciprocation and, following the ancient traditions or the traditional way of conducting these healing healing processes. And then we have, I did see a study because I was, I'm not sure if you guys were attending. There was a psych summit in London not long ago. And I did manage to watch and follow some of these new emerging technologies. And at the same time, I did see one study from Beckley Foundation. It says that the mystical experience is what increases the capacity to recover from addiction. Mm-hmm. So the mystical experience piece was like the key almost. And I'm guessing when we and what you're doing is very different. What are your thoughts on how does the mystical piece come in? It's almost like, I speak to so many people. They say if there's no mystical experience, there is no healing. It's quite conviction. Convicted in the way they think that without mystical experience, there is no psychedelic experience. So, or healing or any benefits at all. What are your insights on that?
I had similar thoughts about it when I got into this. I saw that there were companies who were trying to make psychedelics without the psychedelic experience. And I said, it sounds like they're trying to invent water that doesn't make you wet, right? How could you, it's not water anymore, right? How is that going to work? And what I've learned over the course of this is that you can't really put a blanket across each of these indications. So in something like addiction, which has a profound mental health component to it, similar to other, like eating disorders and things like this, the mental health that's sort of shaking you out of your reality is a powerful experience for those people. And I would say that's an area that we will participate in as well. But in the case of neuroplasticity, it's fairly well supported that the neuroplastic effects from psychedelics for 5-HT2A drugs are really only required through a microdose. And that makes it for a more attractive drug for a couple of reasons. One is that you're sort of easing people into it, right? they're going to have some, everybody says non-psychedelic, you're going to have some psychedelic experience, right? You're just not going to, see everything in a full, 3 gram or 5 gram dose. But it makes it attractive because if it's a psychedelic dose, I think that we might be able to convince the FDA to make it an at-home, self-administered type of process with very little oversight. It is a multiple time a week dosing regimen. So that will be something that is attracting investment for it, and it fits within the payer model, right? So the payers aren't, if you have a payer, you say like, well, I'm going to send them to 2 sessions and it's going to be $50,000, right? They're going to have a lot of questions, right? But if this is the same price as a pill or something like that, they're taking it for 3 days a week, maybe 6 months or something like that, then you've got a very attractive product for investment. But we do believe in those other areas that the psychedelic experience, the full-blown psychedelic experience, is going to be necessary. And even with our drug, the S119, it is a full psychedelic drug experience, similar to psilocybin, and can be applied in all those areas. But it's not required for the stroke patients, we don't think. So we will be doing it in a different way for that.
That's great. Don't get me wrong, I'm a massive fan of the microdosing. I love that we have now this information, and also a fan of Dr. James Fadiman's work. Yeah. And he's been a guest to our show as well in the past, a few months ago. And I think coming from a holistic therapy background, I really understand and value how microdosing can incrementally change and impact the neuroplasticity and all the benefits that don't require the mystical experience. So I'm fully on board with this idea. And also in the West, coming from super busy lives, and I always say I love the indigenous aspect, and I love, the reciprocation and honoring and sharing the medicine like in the past. But then, as you said, as we're moving forward in 20 years with the speed of information technology and AIs and all of these incredible advancement, what can we do? What can we bring to our people in the West who has busy lives, 2 jobs and 9 to 5 and all these crazy, schedules? Can we make their lives easier? Can we help them in some way? Because they may not be able to take away, like you said, a whole day, a weekend or a week to get away and do these processes or embark on these new alternative ways. So I truly understand that. And of course, again, microdosing would be for me is probably the most powerful frontier in changing lives, even in mental health. Even in mental health, in mental health, actually, for me, has been the most powerful, because we do a lot of integration group processes. And I was going to just say to you one thing, that I would love to hear your insight on the group processes, as opposed to somebody who purchases these pills and they have the green light to go ahead and start their treatment, but they are on their own. So how would we close the gap in the education, information, and mentoring, or maybe even can they do this on their own with your products? How is this covered in your company?
I think that's a very difficult question to answer at this moment. So, we're interested in ketamine, for example, and ketamine clinics. And, we've seen some concerning developments pop up in terms of like people's business models and how they're going to be doing it. So you have the mental stability part, where you want to have the preparation, the integration, and someone there to sort of watch over you while you're going. But in addition, there are people who, respond very poorly to something like ketamine, for example, where their blood pressure may shoot through the roof, right? Or they may have really bad nausea, right? And if you're in a clinic and you're getting it administered in that way, then you're getting the oversight and the care that you need, and they'll give you anti-nausea drugs, or they'll give you a beta blocker to bring down your blood pressure. The last thing we need are people dying at home from online ordering or having, a psychotic break from things like that. with the microdosing of sort of the tryptamines and the classical psychedelics, it was one reason that I switched from microdosing to macrodosing was exactly what you were talking about. There's a very narrow window where you've got the subpsychedelic dose, and then if you go just a little bit over that, you're not really doing much for the rest of the day, right? So there I saw, the ability to run dose ranging studies and get control over the exact amounts that you're getting in each delivery method, whether that be a pill or inhaled or whatever. That's a real value add that can contribute to the microdosing movement with that. On the time saving piece of it with the macrodosing, I got really interested in that piece as well, not knowing about the drug we're taking forward now, but with psilocybin, I got interested in what's called, do you know what lemon teching is? Yeah, so lemon teching, and I said, I just put this in the tea with the lemon juice, and then 3-4 hours we're done, and I'm back up and I'm recovered and good to go the next morning, versus being wiped out for an entire weekend where I've been up till 4 a.m. or something. So that was sort of my thought on it. Sorry, did I answer your question, or did I?
Yeah, you did. And
Yeah.
I'm just more interested in the group process because, I come from, like I said, a holistic background where I have this idea that human beings, we've wired to be connected, and group processes have been really powerful for us, meaning that I call it healing out loud. Others witnessing our journey and support. There is an incredible support, non-judgment, and people have probably all walks of life, but there's one thing in common, which is they just want to improve their lives. And I think that's a really great foundation to bring people together in a common experience such as microdosing. I love that. And I found that compared to people who's been doing a solo, I call it the solo journey, meaning they take their alternative treatments on their own hands and they do this thing on their own, as opposed to a group container or a group processes. I found people in the group processes receive somehow more amplified benefits. So I just wanted to take your insights on that.
So it's an interesting thought on it. When you think about the ancient traditions, and you go all the way up through the 60s, you go up to the time when I was in college in the 90s and things like that, that strengthening of bonds and strengthening of community and being there to support each other was a very interesting experience. Now, I will openly admit, I probably shouldn't, but I've not tried ayahuasca yet. I've not tried 5-MeO DMT. But what struck me was that when I had taken LSD or I'd taken psilocybin previously, I did want to be in a group, but I only wanted it to be in a group of friends. I only wanted to be with people that I knew. So I was really fascinated by the idea of these ayahuasca circles and the way people who were strangers who didn't know each other were coming together. And so I probably don't have a great answer for you on that because I haven't experienced it yet, but I'm looking forward to experiencing it at some point.
Thank you. And probably we won't go into the other dark side where what happens when strangers come together and they project all these things that they carry, and there's a whole lot of baggage we don't want to go in today. But thank you for answering that. Yeah, I'm sure we'll have you back on another episode following your journey and also your progress with the company. So that being said, let's jump on to your organization, Ninnion Psychedelics. Interesting name. And just before we went live, you were telling me how you found it and the name, the background to the name. If you could just tell us how it was birthed, and then we can maybe take it from there.
Sure. So naming a business is, for any entrepreneur who's done this, is one of the most difficult mental challenges that you go through. You have a lot of throwaways and a lot of word salad that you put together for things that sound like something. But we settled in on the story of Eleusis and the Greek mysteries. Eleusis was a great name. I liked that one a lot. That one was kind of commonly used. There was a lot of stuff out there on it. And we started looking around the different goddesses like Persephone and Demeter and Hades and these others, and also didn't sound quite right. But then we came across this Ninnion. And so essentially the travelers who took the road of Eleusis to the temple, and they drank the kykeon, which in Western societies believed to be the first recorded evidence of psychedelic brew. from grain or beer. And the Ninnion was the clay tablet that the Greek mysteries were, or the mysteries were written down on, that people had there to read. And so we thought that was kind of fitting on a journey, being a guide, taking these medicines from, basically, obscurity or paranoia to kind of actual pharmaceutical medicines.
That's amazing. That's wonderful. Yeah, I like that, having a little bit of a story weaved into it. It's great. So what's the future is looking like for you and for your organization, your team, the capacity, and what are your projects that you're currently working on? Is there anything that you'd like to share with us?
Yeah, there are some things I can share and some that I can't. So we've spent the last year putting together the team. We signed multiple deals that we haven't yet announced, but we're about to, basically solidifying our footprint in drug discovery and development for these sort of next generation, the second and third generation type of psychedelics. I started the company during the pandemic, and so we've been from the birth a virtual company. But we've been looking for office space and ready to move to that next phase of funding, where we all come together in the same place and really, sort of push a company forward. We're in the middle of our seed round right now, and we're out looking for investors and attracting a talent. We're hoping to do a Series A investment towards the end of the year, which will really be a launch pad for us as a company.
That's brilliant. And you talked about Dr. Rick Strassman as one of your company's consultant. So what do you think of his? I mean, he's one of the most dedicated people that I've known since being involved in the psychedelic space. And if you could maybe, what your relationship, and also how is he going to take? I mean, what other names that you have? Maybe you could just give us some insights into that.
Sure. Yeah. So Dr. Strassman was at the top of my list when I went out there. I knew about the embargo on psychedelic research for forever. And I knew that he was the first one who basically got basically in human studies back in the late 90s, University of New Mexico. And then I found out that he got the DEA to actually fund it. And I thought that was an amazing, or either maybe NIDA, or they basically funded the research, and this is basically launched into everything that we're doing now. The ironic thing, after watching DMT, the Spirit Molecule, on Netflix and these others, it was the 90s when Dr. Strassman did this. So he was actually quite surprised that 20 years later, 25 years later, that suddenly this is relevant, and now he's at the top of the form. That said, he had not agreed to work with any companies prior to us, and he'd been approached by the big ones. So he was very serious about the people that he wanted to work with, and it shows in his work. He's dedicated to us. He's made amazing connections for us, and has amazing insights on the drugs themselves, dosing protocols, whatever, as an MD. And it's been a great experience. And we recently attracted Dr. Charlie Nemiroff from University of Texas, who's one of the legends in drug discovery and development. Dr. Roland Griffiths assigned Dr. Patrick Finan to come and join our scientific advisory board. Dr. Bill Massey, who's put like 28 drugs into humans and 8 of them to market approval in CNS, joined last November. And it's just been it's kind of a dream. I have to pinch myself sometimes to realize it's all sort of something that was on my couch 2 years ago to this fully functional company.
That's wonderful. Thanks for sharing. And, your story, I think there is always this deep personal drive, when we bring and make and manifest these beautiful, things that can help others as well. I think there is always this deep personal drive that is very connected to your own journey. I think I can clearly see that also. I'm really thrilled that you will be looking into the strokes and the brain injury and neuroplasticity and all of these areas. I think it's so needed right now. And just want to ask you one question about the legal landscape. How is it for you to move around this space? Is it really restrictive? Because I'm not part of an organization such as yourself, so I don't really, get to speak to a lot of you guys. So what is it what are your challenges as an organization?
Well, so I mean, drug development is challenging. Period. I think when psychedelics, I did the parallel earlier between cannabis and psychedelics, and I think a lot of people don't realize actually what it takes to get a drug to market. Not only the amount of money, but the amount of time, right? And so, if you're in the CNS space for pharmaceuticals, the probability, if you start with 5 or 6 drugs in your pipeline, typically the approval is about one of those drugs is actually going to make it, right? Each one of them will cost around $100 million to get through clinical trials, just as a round number. So you're looking in the typical CNS space of upwards to almost $1 billion to get one drug to market. And I think the early financing community was maybe more set up for seed rounds or for these more consumer facing things like clinics or the eventual legalization through dispensaries like cannabis. But there still lacks that sort of connection between like, okay, well, once I've gotten through a phase 1 clinical trial, who's going to actually get me to commercialization of this drug, right? Where's the other $50 to $75 million going to come from? And who out there is willing to take the risk on those types of drugs? And so that's where I think, when you saw companies like MindMed and Compass and Atai go public last year, the valuations, even though they're not as great as they once were, but the valuations of those companies started to attract other types of capital, say, hey, what is this that they're working on? How is this happening? Pharma is starting to come to the table now. So we've seen that the deal with Otsuka Pharmaceuticals in Japan with Mindset. And I think there's only more of that to come. So I think there's clearly a pathway now to actually get us from this side to the other. And microdosing will play a large role in that.
Yeah, that's great. And do you think it's easier with the approach with microdosing as opposed to the macro and the big full-blown experiences and things like that? I think is it easier to take that approach with the microdosing? Would you say?
I think it is. These products, because of microdosing, if you use Fadiman's protocol or Stamets or whatever, they're typically saying 1 day on, maybe a couple of days off, not more than every other day, something like that. You don't want to build up the resistance to it. And so that, from a sort of recurring revenue type of standpoint, is very attractive. It attracts investment much easier. It gets people closer to psychedelics. It introduces them to psychedelics, maybe makes them less afraid of it. And then maybe one day in 30 years, everyone is just going to, a great outdoor spa or something like that, where they spend the weekend and, it's accessible to everyone. And mushrooms are the answer. So.
Yeah. Thanks for sharing that. Currently, you are working with psilocybin. Is there any intention or plans to work with any other substances?
So we're not actually working with psilocybin. We're working with a substituted tryptamine that is between psilocybin and DMT. So it's in that sort of realm. And we are about to announce an AI drug discovery collaboration, exclusive collaboration for developing these new drugs. So how do you get better control over the dosing? How do you get better brain barrier penetration? How do you get rid of off-target toxicity, things like cardiac toxicity and things like that? That'll be the main focus of our development programs. But they'll all start with these sort of, kind of tryptamine-based molecules that we will modify for the desired effects. I mean, right now, if you do a ketamine infusion, it's for a mental health protocol. You have the 6 sessions, and typically the infusion is like 45 minutes, right? Mm-hmm. Now, I don't know if we'll ever get down a true psychedelic to that space, but if you can cut it from, 6 to 8 hours down to 2 to 3 hours, you've made really great progress in terms of making it more affordable and then making it available through payer access.
Okay, thank you. Got it. So the idea here is to make it more accessible and shorten the time that people, the time that needs investment and for people to make it easier to access. Okay, got it. Jeremy, it's so wonderful meeting you and speaking with you. And thank you so much for sharing your mission and your company's, projects and everything you guys are doing. It's incredible. As we come to the end of our conversation, is there anything you'd like to talk about that is close to your heart that you would like our listeners to hear from you?
Well, I would just like to say thanks for having me on today. The podcasting community and YouTube and the people who are generally just passionate about this area just for the sake of being passionate about it, right? Because of their personal experiences and things like that. It really helps, entrepreneurs like me and companies like us to understand really what's happening, right? When I started the company back in November 2020, there were only 3 or 4 companies that were out there, right? The phase 2 data hadn't come out on Compass or Maps or anything like that. So we had no idea. And once you get into the entrepreneurial phase and you start raising money and you have your head down and pushing forward your strategy, it's difficult to keep up with what everybody else is doing. And these sort of forums create a great space for, people like me to think about my company and challenge me and, for how we do things.
That's wonderful. And this is why we do these podcasts, because we want to get to know those people behind these organizations. It's easier for me to have a conversation with an independent solo facilitator from indigenous or the modern approach, doesn't matter, or therapeutic or mental health. It's easier, but it's always this a mystery behind these organizations. Who's behind the mission, who's got this deep drive to bring this to our people in the West. So I'm always interested and intrigued and curious. So thank you for sparing your time. And I'm sure our listeners are going to be following your company and your mission, your projects, and maybe dig into a little bit more to understand. Because there's a lot to learn, a lot to talk about. And this is why we have these conversations. So thank you very much for being here.
Yeah, thank you for having me.
Wonderful. Thank you, everybody, for joining us. Hope you guys enjoy this conversation. And if you have any questions, anything you'd like to share, comment below and don't be shy. And if you wanted to get in touch with Ninnion Psychedelics, we'll have all the links and information direct to Jeremy and his organization. So thank you so much. We'll see you guys on the next one. Bye for now.
Thank you, Susan.
Thanks,
Bye-bye.
Jeremy. Bye now. Thank you so much for joining us. Psychedelic Conversations podcast is designed to educate, inform, and expand awareness. For more information, please head over to psychedelicconversations.com. You can also share with your friends or leave a review so that we can reach more people. You can also join us in our private Facebook group to keep the conversation going. This show is for information purposes only, and it is not intended to provide mental health or medical advice. Thanks for listening.